Welcome to your favorite doctor show on television. It's time for We the Doctors. My name is Dr. Jules. Today we're talking about something that affects millions of people all over the world. We're talking about osteoarthritis. Osteoarthritis, I'm sure it's not the first time that you're hearing about this. And when you think of it, you think of joints, don't you? Yes, that's what we'll be talking about. We'll help you understand it because what we care about is helping you make better healthcare choices, okay? So we are going to talk about osteoarthritis. I have my colleagues with me, Dr. Valeria, Dr. Yvonne, and Dr. Oke. So, guys, osteoarthritis is very common.
Absolutely.
60 to 70% of the people that get this condition are above 60 years old.
Absolutely.
And basically what is happening is there's a protective layer in our joints, the common places including the knee, the hip, okay, the hands. That protective covering of the joints becomes, wears away. Exactly, it degenerates. That's why another name for the disease is chronic degenerative bone disease. But let's not bore you with that. Let's talk about the symptoms, how we recognize that the patient is suffering from osteoarthritis. So who's going to start?
Yeah, the first thing to talk about is pain.
Pain.
They tend to complain about a lot of pain. The person will tell you that he or she is having pain in the knees, the hips, like we talked about before, and also tenderness. Like when you touch the area, it's actually very, very painful. True. They wince and they're like, oh, it's painful. So pain is very...
And
the classical one.
In addition to the pain at those joints, you get complaints of stiffness.
True. Like they cannot move that part of their
Yes, they find it difficult to move that part of their body. Someone that was otherwise very flexible, like I'm trying to flex myself, and the person now moving this way and even finding it hard to come back. Exactly. That stiffness is always there in osteoarthritis.
Yes, and they can't even flex, the whole thing. And
the joints really, properly.
Yes, it's really common amongst the elderly most times. I think in most of our practice, once you get an elderly person coming to the hospital to see you, some even above the age of 15, some people even young adults nowadays that are probably obese and all of that. And by the time they come in, you just tell you, doctor, I get arthritis. You already know most times they already diagnose themselves.
Commonly, they even tell you it's rheumatism.
Rheumatism. That's
what we get in our
exactly. Rheumatism, the worry me. This place, I don't feel bend down. If I stand now, wahala.
And like you said, it's mostly in the elderly. Exactly. Well, if I want to give another description, let's imagine a hinge of your door, okay? And sometimes it can wear from from the exposure of air, water and all that. So it becomes very stiff. So you can imagine usually our joints, they are very, very flexible. And then when it becomes very stiff, just like the door, what we used to do, we put oil, that lubrication that has been lost. That is why it's like that.
Now we are going to find a way to put oil on this osteoarthritis.
Yes, we'll be talking about that. But apart from that, one thing that we doctors look out for, because like I mentioned earlier, I said chronic degenerative bone disease. So joint disease. So it takes a while for it to happen. So not because when we know that some people, especially in sporting injury, you come in, maybe somebody hits you on the leg or whatever. That is not arthritis.
That single hit is not arthritis.
It's not arthritis. When you come into the clinic, we palpate. When I say palpate, we put our touch. We put our palm over the area, and then we get a gritty feeling when you move the joints. We call it a gritty feeling. It's like there are pebbles or there's like small particles in between the joints because the bones are rubbing off against each other.
Yeah, that reminds me about the bone spores that they have. These are like tiny bones that feels like hard lumps, forms around the affected joints. So sometimes you just notice that there's a little part of swelling around there and all that. That's also
and even when these swellings are not there, when you do an X-ray, you can actually pick out this
absolutely.
Especially when the cartilage is completely worn out, okay? Now, we are talking about cartilages, we're talking about bones. We are like, what are these doctors talking about? Carry us along. We will. Just hang on. Dr. Yvonne is going to give you a beautiful illustration talking about the bones and the cartilages. Stay tuned. With the Doctors continues right after this.
Coming up next.
There's usually a cushion around there. This cushion is what is called the cartilage. It is firm and slippery, like Dr. Jules explained earlier, so which makes it easy for both bones to move against each other. Hello, you're welcome back to We the Doctors. I'm Dr. Yvonne, and this is the illustration segment. We've been talking about osteoarthritis, arthritis as most people commonly refer to it as. It's the most common form of arthritis, talking about osteoarthritis. And in this segment, we'll be talking about the risk factors for osteoarthritis. But before that, let me take you through how this osteoarthritis comes about. It's a degeneration of the joint cartilage. Basically, that's what it is, and the underlying bone, meaning wearing off, in simple terms, degeneration. So what happens is this. At the end of the joints, there's usually a cushion around there. This cushion is what is called the cartilage. It is firm and slippery, like Dr. Jules explained earlier, so which makes it easy for both bones to move against each other without friction. Is smooth. But in osteoarthritis, what happens here is that there's a wearing off of the cartilage. So the surfaces that used to be smooth before now become rough. And over time, they wear off completely, such that you now have bone against bone. So you cannot imagine how, that's what brings about the many symptoms that we talked about earlier on. But let's mention some of the risk factors that these people actually are prone to. The first thing I'll be talking about here is older age. As we age, we get older. We're not as strong as we used to be before. And so there's changes going on in the muscular regions of the body. So that's one risk factor.
I think that makes common sense. Imagine, look at it this way. You know that old Bako cabin biscuit that we used to imagine putting a layer of butter in between and then leave it. When you begin to rub it and the butter is going off, you feel like it's osteoarthritis.
That's how you know people that.
Yeah. That aside. Leave the Bako on the table, leave it for 2 days, come back. Somehow,
Bako, I don't understand.
The biscuit with the butter in between, just leave it there. By the time you come back 2 days later, the butter is gone, and you don't know what took away the butter. That's what happens in old age. As they get older, yes, you find out that this butter in between for the older people.
It balances off.
Forget about the Bako.
And also, it's more common in women than men anyway. It's very explanatory, being that the female hormone, when a woman is still menstruating and all, estrogen actually protects this cartilage. So it stays and is always present. But in menopause, when there's no more estrogen, so there's no more protection for the cartilage, so it's easy for it to wear off. So that's why.
Now, our joints, we use them over time. I keep saying this thing. We have generator, we have cars, we service them. Why? Because these things, they lose their, the movement and their efficiency. The same thing, the human body, if you don't maintain it properly, not that you caused it, sometimes some people are predisposed to it, but you can imagine if your weight is higher than for your height. We talked about the body mass index. If you've watched our episode on your weight and you notice that we talked about your body mass index. Your height is supposed to carry a particular weight. So you want to check that with your physician. Just imagine you're too big.
So it tells whether you are obese.
Yes. If
grade 1 obesity.
Exactly.
Grade 2, or you have morbid obesity.
If you are obese and you've been carrying that weight for a long time, I mean, it's self-explanatory.
Like
it's even mechanical.
Absolutely.
The pressure on the joints, your hip, your knees, over time, it
crush the Bako.
Exactly. You crush the Bako.
Yeah, that's basically it. That's the simple of remembering this. Just
basically, being obese can predispose.
Yeah, put stress on your weight-bearing joints.
Exactly.
One other thing that is important as a risk factor is previous injuries to your joints. You're a footballer, you've had an accident, it could be even even the games we played as children, and then this healed.
Piggyback.
But just like a scar you find on your skin, you had an injury and then there's a scar on your skin. Over time, you find out either the scar increases in size or regresses. There's always some change happening there. When it's regressing, that's that degenerative disease we talked about of the joint, regression at that joint. That's how these joint things happen. Again, for some people that are born with bone and cartilage deformities, they are really not that common, but we see them in the hospitals. They have a tendency of developing osteoarthritis also because you find poor weight displacement. Let's say the bone is bent this way, the leg is keyed, or what's the other one, bowed. You find that the balance of the weight is no more where it's supposed to be. So an edge is touching, one bone is touching the other more than it should. And then it's just like someone being obese. there's a tendency to have osteoarthritis.
All right. One of the things that is a risk factor for osteoarthritis is the occupation, really, the kind of work that you do. So you find that some people do a lot of writing, the teachers and stuff like that, or you do a lot of typing at work. Sometimes after a while start having issues with their hand and all of that, start complaining about the arthritis of the fingers. And then some soldiers, for example,
standing for too long.
Standing for too long. Yeah, teachers will stand for too long. Soldiers will always marching and moving around for too long, walking around. Even farmers have to trek long distances to their farm and stuff like that.
Bending an awkward position for a long
those people
time.
that are doing like dry cleaning work and you know, that always have to wash and all of that. And
with their hands, I thought they used machines.
No. We call them dry cleaning. I don't know washermen and washerwomen. That was.
Oh, okay.
So that's why we say they're doing dry cleaning until the general. Well, to cover up everything. Yeah, but the manual one. That you have to bend down a lot and all of that, or you bend down to cook and all of these things. So when you do that, you're putting pressure on the weight-bearing joints. You're talking about the hips, you're talking about the knees. And then it's also genetically, you know, inclined as well.
Because most times if your father, your mother had osteoarthritis, there are chances that you might have osteoarthritis.
Given the environmental factors
Yeah,
provided.
Yes.
Hopefully all things shouldn't be equal here, but if all things are equal,
hoping that I have a normal weight and I exercise.
Exactly. Keeping healthy. All right, so let's go over to the streets and hear what people have to say about osteoarthritis. Don't go anywhere because we'll be right back.